Hi everybody, it's Dina and Jaco again, ready to have a chat with you about one of the topics that we've been asked to get some more information on. Today we're talking about dermal fillers. So this is something that I actually don't know very much about myself, so I'm really interested to learn a bit more about it. So what are dermal fillers?
Well, dermal fillers is mostly a hyaluronic acid filler. It's like a gel. You can think of it as a gel that we inject anywhere we want to volumize that particular area. So let's take, for instance, your lips. So if you feel you've lost a lot of volume in your lips and you want to make your lips look more plump, then we simply just inject the dermal fillers in your lip, and that makes your lips look slightly bigger and more volumized. So that's basically what dermal fillers is.
Is there any other areas that you can then use it in?
Yes, there's loads of areas. Typically what we try to do with dermal fillers is to restore areas that's lost fat. So everywhere in our face, as we get older, we lose fat in our cheeks, for instance. We lose fat in our lips, and a lot of that fat might migrate down to the jaw, and we get the jowls. Or we might have lost fat in our temples. So dermal fillers are really a good way to restore those areas where fat loss has happened, like under the eyes, augmenting the cheekbones. And, if we end up with thin lips when we get older, we can put a bit of dermal fillers in there. So it's very good for that. And also in the chin, and in the temples. The temple is quite a good area where a lot of people, as they get older, get sort of sunken in temples, and that makes us look very old. So to restore that. So that's the most common uses for dermal fillers. There's loads of other uses as well. And a dermal filler is basically made from hyaluronic acid.
I guess the big thing everyone's going to want to know is there any risks to using things like dermal fillers?
Yes, certainly with every kind of treatment, there is a certain amount of risk involved, and with a dermal filler, we deliver the dermal filler with a needle. So there's the common risks involved of damaging structures like arteries or veins or nerves with the needle when we place it in your skin. We obviously take a lot of precautions to minimize the risk. And the more serious side effects or risks involved with dermal fillers is if we occlude or block an artery or a vein that supplies a specific area, and then we can get necrosis of that area, or in the worst case scenario, there's been even cases of blindness has been recorded. So there is some risks, but we make sure we have a very good understanding of the anatomy in that area and where we place the filler, and we try to mitigate and keep that risk to a minimum.
And I guess that's why it's really important for appropriately trained people then to obviously do this kind of treatment. And obviously, yes. I guess another big question is, what's the costs involved in something like dermal fillers?
Yeah, so dermal filler, the cost varies. Normally, to sort of give you an idea of how much it costs, if you want your lips restored or augmented, that's normally about £300, because it will normally take about one syringe to do that. So it starts normally from about £300.
And how long would, let's say, a procedure like that then last somebody?
Yeah, that's a very good question. So again, we go on what the manufacturers tell us. They tell us a good quality dermal filler, like what we use, would normally last between 12 to 18 months. It varies again from product to product, and it varies from where you use it in your body. And in some patients, it just doesn't last that long. And in some patients, it lasts a lot longer. And in some areas, it lasts longer as well.
Okay, that's been really interesting. So if you have any questions about dermal fillers, then obviously, like Jaco said, drop us a message.
Yes, please leave a comment. And thank you very much.
Thank you. Bye.